Madam Clerk, can we call this meeting to order, please?
Vice Chair Breton, if it's your pleasure, I will do the announcements.
Thank you.
Okay. Upon activation of the emergency alarm signal, all persons should immediately exit the building. Please use the exits to the left or right front of the council chamber or the east or west stairwell outside the rear doors of the chamber. Do not use elevators or escalators. After exiting the building, proceed down 9th Street and into the assembly area located in the former public safety building parking lot. Able persons should assist visually and hearing impaired visitors when exiting the building. Public speaker guidelines. Individuals wishing to speak during public hearings and the public comment period are generally allowed 3 minutes to speak. Persons appearing before the committee are not allowed to campaign for public office, promote private business ventures, use language of a personal nature which insults or demeans any person, including comments directed at public officials or staff members that are not related to their official duties, or address or question staff members directly. All questions are to be directed to the committee chair. Failure to adhere to these guidelines may result in speakers forfeiting any remaining time, and further disciplinary action is necessary, which can include barring from attendance at future meetings of the committee for a period of 6 months. And Vice Chair Breton, all members are in attendance today with the exception of Chair Lynch, and you do have a quorum.
Thank you. Can we please move on to public comment?
Public comment is now open. Is there anyone present who wishes to address this committee regarding items not on today's agenda? Mr. Vice Chair, seeing none and no one signed up to speak virtually before the 10 a.m. deadline, the public comment period is closed and back to the committee.
All right. Well, I would like to actually begin with the discussion item on the agenda. And I would like to invite CIO Sabrina Joy Hogg to please introduce our new Deputy Chief Administrative Officer for Human Services.
Good afternoon. I'm Sabrina Joy Hogg, interim CAO. And as the Vice Chair just said, I'm here to introduce our newest Deputy Chief Administrative Officer for Human Services, Amy Popovich. Amy is a respected leader in public health and human services. She has spent more than a decade advancing equity, access, and innovation in Richmond. As the DCAO for Human Services, she will oversee a wide range of initiatives aimed at improving health and the well-being of our community. So for a little background on Amy, she began her career in nursing, but her impact has grown far beyond the clinic. As nurse manager for Richmond and Henrico Health District, she led a team of more than 100 professionals focused on school health, newcomer services, chronic disease prevention, and community-based care. Amy was also a driving force behind the Community Health Worker Initiative launched in 2011, which has now grown into a statewide model with a formal certification program and $3.2 million in ongoing funding. She also helped establish the Richmond Henrico Public Health Foundation and the Health Equity Fund to ensure long-term support for underserved populations. And during the COVID-19 pandemic, Amy led a regional vaccine coordination effort, helping to build trust and ensure that distribution was equitable and community-centered. Her leadership has earned her honors from both YWCA and the American Health Nurses Association. Amy brings a rare combination of vision, compassion, and an action to every challenge she takes on. I'm sure you will find her a very willing and collaborative partner as she assumes the administrative responsibility for this committee. So would you please join me in welcoming Amy's first committee meeting?
Good afternoon. As CAO said, I'm Amy Popovich. Very excited to be here to bring my 15 years of public health work and almost 20 years as resident of the city of Richmond into the work here, and really look forward to our partnership. Thank you so much.
Well, we are also looking forward to collaborating with you. It's a very impressive history. And so I have all the confidence that you have the values, the credentials, the stamina to do all the important work that we have here. So I'm really glad to meet you and have you on the team. Madam Clerk, can we move on to our presentations, please?
Hey, good afternoon. I am Natasha Haupt, the Program Manager of the Office of Aging and Disability Services, and I am joined today by Ms. Tony Beecham, who's our our Aging Services Coordinator in our office, and Ms. Monica Huddleston, our Disability Services Coordinator, could not be here today. And so I guess a year and a half ago, January 2024, I was before the EHS committee sharing the results of a needs assessment that our office completed in the late part of 2023. And today I am here to provide a report and update on what we have done since that time and in our office related to this report. Just to provide an overview of our office, we do serve residents that are 55 years of age and older, and those that are 18 years of age and older with a physical disability. We have a direct line of contact to our office from residents, caregivers, and the like. People will contact our helpline, and again, directly to us with a lot of different concerns. Here listed, you'll see some of the trending reasons people will call our office, whether it's from housing to needing assistance applying for benefits, and different items here. And homelessness, home repairs, food insecurity, and affordable housing, those are some of the top reasons older adults will reach out to us for assistance. And now as we move into more information related to the survey that we completed, this is just a snapshot of a demographic snapshot of what the city of Richmond looks like related to older adults. So as of at the time of this completion of this survey in 2023, the landscape of older adults was about 57,000 people, a little better than 60. And so right now, as we've moved into 2025 and we're slowly approaching 2026, that number has increased to almost 70,000 older adults in the city. And there's a lot of data to support the aging population as being as we'll be outnumbering those that are 18 years of age and younger in the year 2034. So the aging population is continuing to grow, and that's why this report is so important. Moving forward, just to provide an overview recap of this assessment, again, we worked with the Knowledge Advisory Group to complete it. Our focus areas were affordable housing, neighborhood conditions, that type of thing, built environment, healthcare access, social supports, and transportation. We spoke with what we call key informants. Those are folks who are directly working with older adults. We also, of course, work with older adults. We had about 495 that we spoke with. We provided focus groups as well. And again, as I mentioned before, I was before the council in 2024, January. So from our needs assessment, the project team generated 5 key takeaways, and those are built environment. I'm sorry, those are not the takeaways, but the 5 key takeaways. The most common identified needs were built environment, housing, and technology. Our older adults explained also that fitness exercise, adult enrichment classes, and cultural events are events and activities of interest to them. They also explained to us that services with the city and community partners are not easily accessible to those who might need them. The City of Richmond's communication about their services regarding older adults were rated as either good or fair, and older adults prefer the paper or written communication. And lastly, the 5th takeaway was we were able to obtain the Senior Navigator document with over 900 resources for seniors in the city. And at the time of the survey, we did not have the usage and capacity of those items there. So moving forward, from those 5 takeaways, there were 9 assessment recommendations, and we don't have to cover them here because we will focus on just a few focus areas, and I'll have them highlighted here. So number 1, reviewing community assets related to senior engagement. This was one of the recommendations that we were given that we need to look into. And so as we think about senior engagement, we were able to engage Parks and Rec, City of Richmond Parks and Rec, as well as our community partners to determine what type of leisure pursuits are already available so that we can further communicate that to our older adults. We're also working to increase program offerings and to hopefully provide more senior-focused engagement activities. The city does a great job offering lots of programming, but our older adults are telling us that they want programming specific to them. And in our office, we are initiating an annual interest survey. That's something that we've not done before. So we're hoping to do this twice, at least at a minimum twice a year, but just reaching out to our older adults to find out what is it that you want, what is it that we're not doing that we can provide for you. Next recommendation is to expand and coordinate research findings to improve our asset mapping. We again had a document with over 900 assets identified. That's a senior navigator. But at the time, we did not know what the capacity was. And so what that's been a project that we've been slowly working through, but we were fortunate to acquire two support staff from the Office of Neighborhood Engagement from the Ambassador Program. And they've been able to work diligently through that document to identify the active organizations, the capacity, program participation costs, all the important factors that our older adults will want to know as we share with them what information is available and what resources are available. Improve awareness of services that are available to seniors in the city. One of our overarching theme with this survey is that our older adults just don't know what is available to them. Our city moves toward a more digital platform. However, that leaves out a lot of our older adults. And so we are working in our office to identify funding sources that will allow us to provide a minimum of a twice a year direct mailer to our older adults. Because again, as I mentioned before, they do prefer that they receive paper or written communication. Our office hosts a monthly learning session with the DSS Adult Services team, where we have professionals come out and speak about various topics and share information with our older adults. And in our office, we've created an outreach plan where the three of us, will go out and visit senior facilities. We provide lots of information, host many resource fairs, and just speak with them one-on-one as needed so that we can begin ensuring that they're at least aware of what the city offers them. Our next recommendation is it's a loaded recommendation, but we'll focus on the latter portion of it, is improving the capacity for safety checks for those that live alone so that we're not recreating the wheel. We are working with the Richmond City Sheriff's Office. They have an Are You OK program, which supports about 32 people at the moment, and we have a pretty solid list of residents that we would love to move to that list. So we're working with them to determine how we can move some of our residents to their Are You OK list to have them receive a phone call at a minimum once a week, but sometimes once a day, just to check in on their well-being, make sure they're safe, see if they need food, and any type of other concerns that they might have. So we're currently working with them to make sure that we don't overwhelm their capacity, but that we're still able to provide the needs that our residents have. Another healthcare point, increase the availability of trained certified nursing aides through no-cost training. This was another recommendation from the project team. And today I am actually joined by Mr. Thaddeus Huff of the Office of Community Wealth Building. He's been my primary thought partner in this project. And so we partnered together to offer a personal care aide training program as we continue to work through the process to move toward offering a certified nursing aide program. And with the Office of Community Wealth Building, we partnered with the SPAN Center, formerly Senior Connections, and VCU Gerontology. And these are over to the left, you'll see training components. The course offered trauma-informed care, instruction on ADLs, body systems, cognition, dementia care, all the things that a personal care aide might need to know as they're working with older adults and even persons with disabilities in their home. And so this was a program that started with 9 participants. We were fortunate to end with 9 participants who all completed their personal care aide certification and received their first aid and CPR. And as of, I believe, Tuesday of this week, I believe all of our participants have been placed. If that's safe to say, Mr. Huff said yes. And so we're very excited about that. And increase food pantries in neighborhoods with high populations of seniors and to incentivize the development of grocery stores and food deserts. Well, our response to this has been providing a pop-up pantry because a lot of the majority of our older adult residence buildings are in food deserts. And so older adults are walking to the mini mart and to Family Dollar just to get food, as opposed to having quality food a little more readily available. So we've employed the assistance of managed care organizations such as Humana. They've been the first to jump on board with our pop-up pantry, and Feed More will be providing the food, of course. And they've just asked that we push this project to the new fiscal year, but that is one of our pieces regarding food pantries. And folks, that's the end of my report. Thank you very much.
I got it. Thank you so much for your presentation, and y'all need more staff. I will literally say that. I mean, I call Miss Tony for everything. She is like the go-to. And especially, I know in the 9th district, it is a high population of seniors, and a lot of challenges that they are facing are the things that you named. So I'm excited about you all putting together some strategies specifically around transportation. I know a lot of the like the housing communities, the senior facilities, a lot of things that they share with us is that there are things going on, but they can't get to them. And, calling, asking, could we provide van service? And, we just don't have the ability to do it. And so I think that that is a great start to really begin looking at what the needs are, and realizing, how we as a city, I don't think we highlight enough the aging adults that are in this city. We talk a lot about, or we see a lot of, young people or, folks coming down, but it is really a high number, and we have to really start considering them as a priority, because there are more and more of those housing apartment complexes popping up for seniors. And so the thing that always makes me nervous is they are building the housing, but there's nothing for them. And so I know Southside Community Center has been offering some things and will continue, but then, we have to find other areas across the city to be able to work with them. So the other thing I'll say is that in those buildings, we also, based on which ones they are, they are prone for people to prey on them. The senior community is a community that is preyed on a lot. And we have a lot of organizations that, I started yesterday, but let me come offer you services. And my mom is in one of them. So I'm constantly like, don't answer your door. Don't. So I would just like us to really kind of think of it holistically, and really begin to think about a process and a plan. So everything you named is amazing. And then now it's like, how do we put the action to it? Because it's only 3 of y'all. So I think we definitely need to really, put our thinking caps on and think about that and how we can assist this population. Because it's like the forgotten generation now, and it pains me to see it. I mean, a lot of them don't have families. A lot of them, are alone by themselves all the time. And I feel like as the city, we should really begin to think about our senior community. So thank you for everything that you're doing. Thank you to Miss Tony and her crew. Every time I call her, she answers. I don't care when it is. And I appreciate all the work that you all are doing, and anything that we can do to support, please let me know.
Thank you very much, Councilwoman Jones.
Just wanted to say again, thank you. As you know, in our 5th district office, we have a very, very special and close relationship. We see the work that you do. I had a chance to read through this report. I mean, it's astonishing how much is on your plate with how many staff do you have again?
3 total.
3 total, 3, everyone. So every year, and my legislative liaison, Amy, is going to chuckle at this. Every year, we try to put budget amendments in to increase your staff. And we were successful, because we went from 1 to now 3, right? Or 1.5 to 3. So we're growing, but we know that you need so much more support to take on the breadth of work that you are doing and everything that Councilmember Jones just mentioned, and how important and critical that mission is. So I just want to say thank you. This is more of a question for probably more so on the finance side, but you may know, we had requested, and Will, I don't know if you were able to ask any question we did. Okay. We had requested some funding, to increase our allocation towards direct mail. Because a lot of our seniors, as you know, that's how they're still getting their information. And so they miss a lot of very important city notifications. I think it's a wonderful opportunity for us every year to do a direct mailing of the senior and elderly tax relief program application. And so we wanted to push more money into the direct mail budget for that reason. Do you know if that has happened for your office?
As of today, I'm going to say no. I don't have any knowledge of that. Yeah, we can follow up.
Okay. All right. Go ahead.
Thank you.
Thank you. I was going to concur. I mean, my wife is a geriatrician, which is a doctor for older adults, and so she is always talking about the silver tsunami of more and more aging people in the community, and just all the support they're going to need, all of the accommodations that we need to be prepared to do, and one thing I was interested to hear about more was. Two things. One was when it came to Parks and Rec and the activities that they were asking for, because I'd like to hear a little more about, what sorts of things are successful and how is Parks and Rec responding, and then the other one was the built environment, which maybe I should make it a separate question, but I'll say it now. Tell me more about the types of built environment changes that our aging adults are looking for and how we're coming along on doing that. Is it broken sidewalks? Is it more ramps? And then the last one, I'm giving you 3 questions now, is accessible homes, right? Homes without stairs, right? Is that do we need to be finding a way as a city to make more homes that are accessible and appropriate for people that are aging? And is there a shortage or not? And how are we coming along for planning for those? Those are my, yeah.
Okay. All right. Thank you for those questions. I will start with Parks and Rec. Parks and Rec has been very receptive to the conversation. They do have, again, I want to reiterate, when it comes to our older adults, what they're requesting is programming that's specific to them. So the city offers a lot of festivals and events, but it's community, it's everyone. And so Parks and Rec hosts a very successful senior day at the park every year. It's been so successful, they've had to branch it out into 2 events. And so that is one where it is strictly older adults and it is very well attended every time it's offered. One of the barriers that we run into, and it's a barrier that can be addressed, is location. We do have a lot of older adults that have a difficult time traveling to their recreation, their leisure pursuits. They can get to the doctor, but getting to those other places is a little bit difficult. So that's one of our bigger pieces with figuring out how we can get people to our Parks and Rec facilities. The bus line is always a great option, but sometimes that just physically and accessible, it just doesn't always work for our older adults. And so we're always working to figure out what else can we do to help get them to a location, because oftentimes if they're in a senior facility, they would prefer that the recreation comes to them. And sometimes we can do that with community partners, but we do have a great Parks and Rec team that could certainly fill some of those needs. So in regard to built environment, yes, you're correct. One of the bigger issues that we found is the sidewalks are just not readily available and ready to use by a wheelchair, a walker, whether it's a power chair. And a lot of residents are traveling on the street, which presents a safety issue, or they're just not going out at all. And so that's been a big issue. We have talked with DPW and just asked if we could at least, even though I know that things are in process, we've just asked for maybe a 1-pager that we can share with our older adults to let them know, here's some upcoming construction things that you need to be aware of. So people at least have the knowledge that things are happening, even though maybe they've not gotten to their street specifically. But that has been a bigger barrier as well. And then in regard to homes and accessible homes, so the trend currently, and I don't think it will change, over 90% of adults prefer to age in place. They want to remain in their homes. They want to have the social supports, the technology, all the things that are necessary, but home repairs becomes a big thing. We have so many calls each week regarding just needing funding for home repairs. I'm having to wait for home repairs. In our full report, which is an 80-page document, some of the wait list for home repairs, it can be up to 2 years, it can be 3 to 5 years. And older adults are living in homes with where their roof might be closed in, or they just can't access certain rooms for those same reasons. And so yes, that is a helping our older adults age in place is a very much needed concern, and I think that's another deeper dive we could do to determine if you have that need, what would make your home more accessible for you to remain in it, but also remain in it safely. So we can certainly do some more homework there.
Actually, can you tell me more about the budget, like where the funding comes from? If for city funds that do home repairs, is that a program that
we have? I'm sorry, we have had a city program, Healthy Homes, that has offered some city funding to repair homes. We also work with Habitat for Humanity, Project Homes. Am I forgetting? Yeah.
Well, thank you. Those are very helpful. And I guess I would say that if you're looking for support for the built environment to get better sidewalks, better ramps, you can count on me to help you with that conversation. It's a citywide issue. Everyone here, I believe, would. So people all across the city are looking for that, and especially when it comes to basic accessibility and people being able to get where they're going, it's a large need, and we need to pay more attention to it.
Thank you very much.
Any other questions about? Thank you very much.
Okay. Thanks, everyone.
All right, Madam Clerk, what can we do next? Should we move on to the board appointments?
Yes, Vice Chair Breton, that'll be good to move on with board vacancies if that is your will.
Thanks.
Good afternoon, everybody. Pamela Nichols, Council Management Analyst. The vacancy report before you today captures the current and projected vacancies through August of this year. And so we're going to get started with the Advisory Board of Recreation and Parks. And we have a vacancy for a 2nd District Representative and a reappointment application from Ann Brooks Rich. And then you're going to notice that the second category for a city resident at large, there are 2 vacancies. And these vacancies, Ordinance 2024-265 revised the composition where it removed 2 organizations and therefore created 2 resident at large positions. And so there are 2 vacancies, and we have an application from Thomas Briggs Jr. And then, you want me to continue or you want me to stop? Okay, thank you. And then moving down to Aging and Disabilities Advisory Board for a resident of the city who is a past or current caregiver, or at least one person with a disability, or of at least one senior citizen. So we have an application from Jody Winship. And then for a resident of the city who is a senior citizen, we have Mr. Charles Barker. And Mr. Barker also meets the criteria for a resident of the city who is a person with a disability. He did make sure, he wanted me to note that he actually meets the criteria for 2 positions. And then for the Capital Area Partnership Uplifting People, CAPUP, for resident of the city, we have 1 vacancy and a reappointment application from Sam Parker. And then we receive an initial application from Joseph Chartery. Community Policy and Management Team for a parent representative who resides or work or have a principal place of employment in the city. We have 1 vacancy and an application from Charlotte Talley. And then J. Sergeant Reynolds Community College Board for a resident of the region served by the college who is involved in business, industry, or professions served by the college. We have a 2 vacancy, a reappointment application from Brenda Drew. And then we have an initial application from Joseph Chuduri, I do apologize. Chartery. And then for Lewis Ginter Botanical Gardens, we have 3 vacancies, and we have a reappointment application from Alan Davis, and then an initial application from Madeline Mayhood, who was referred by the CEO of Lewis Ginter. And then moving on to the page 2, for the Richmond Behavioral Health Authority, there are 4 vacancies for individuals who reside or have a principal place of employment in the city. Reappointment applications from Christy Babinko, and a reappointment application from Dennis Cohen Jr. And then moving down for individuals receiving or has received services, or a family member of an individual receiving or has received services, we have a reappointment application from Scott Kennedy, and then a initial application for Noreen O'Brien, and we did receive support for Ms. O'Brien's application. And then for the Social Services Advisory Board for a city resident, there are 2 vacancies. We have 1 application from Caleb Fulford. And those are all the applications up for consideration today.
I'm just gonna motion so we can make this quick. So motion to, for the Parks Advisory Board of Recreation and Parks, the vote for the Miss Ann Brooks Rich and Mr. Thomas Briggs. Following with the Aging and Disabilities Advisory Board, vote in block for those recommendations. For CAP-UP, Mr. Parker, who is a reappointment. The Community Policy Management Team, Ms. Charlotte. J. Sargent Reynolds, those 2 appointments, the reappointment, Mr. Drew, and newly appointed appointee Chowdhury. Same with Lewis Ginter, Mr. Davis, Ms. Mayhood, and the 2 reappointments on the RBHA board plus Ms. O'Brien, 3 reappointments on the RBHA board plus Ms. O'Brien, the DSS board for Mr. Fulford.
Second.
All right. And then, Madam Clerk, can you note that there are several mayoral appointments that are vacant here? Can we send a communication to the mayor's office and just touch base, or don't, take that back, just to see where they are in process with those appointments? I know we have a hard time reaching quorum due to some of those vacancies on the mayoral appointee side.
We did receive communication about 2 weeks ago. They did have a change in who was assisting the mayor's office with boards and commissions appointments. So now Mr. Thad is the one, and so he said that, of course, it's a transitional period, but it's their goal to try to fill some of these vacancies.
Sounds like we have a motion and a second, so let's call the question to vote.
The committee is voting on the board's recommendations as stated. Ms. Jones?
Aye.
Vice Chair Breton?
Aye.
Chair Lynch?
Aye.
That motion has been approved.
Thank you so much.
Thank you, Madam Clerk. Can we move on to the papers for consideration, please?
The paper for consideration is item 1, ordinance 2025-089, to authorize the CAO on behalf of the city to execute an International Rescue Committee grant contract between the city and the International Rescue Committee, Inc., for the purpose of funding a youth development program for newcomer high school students enrolled in the school division administered by the school board. That paper is before the committee.
Can you ask for public comment, please?
Is there anyone in the chamber who wishes to speak in opposition to this paper? Is there anyone in the chamber that wishes to speak in support of this paper? Mr. Vice Chair, seeing none and no one signed up to speak virtually regarding this item, the public hearing is now closed and back to the committee.
All right. Is there any words from the patron who would like to speak on behalf of the paper?
Good afternoon. I'm Eva Colin. I'm the Senior Policy Advisor within the Department of Neighborhood and Community Services, and I lead the Office of Children and Families. We also have Amanda Carolinas in the room from IRC, so if there are any questions that are specific about the organization, she can come answer those. More broadly, the background here is the funding source is the Reserve for Children's Fund line in the budget, which we use outside. It's not in the annual budget. It's money that's been set aside from the past from funded efforts for children and youth that were not used in that budget year, and so we've used it in this funding line. And so ultimately we use this line in the budget to be able to respond to kind of emergent priorities, things we didn't predict at the outset of the budget. And so one of the things that emerged over the past year is the rising needs among our newcomer population. And so as we work with RPS to learn more about the students they're serving, the challenges that they're facing, and then our community partners, we proposed this investment, which would send $25,000 to IRC in order to expand the work that they're doing with newcomer youth. Broadly speaking, this would expand the capacity of their program through the end of the summer, targeting a particularly vulnerable population of newcomer youth at a particularly vulnerable time. And this will be broadly, it's wraparound services. There's a lot of field trips and programming like that. But the existing funding that they have is A, insufficient to do this at scale through the end of the summer, and B, requires documentation of participants. With city funds, they would not have to ask for documentation because the money that is allocated to them federally is tied to refugee students, not newcomers broadly. This allows them to serve more kids and lower the barrier to entry and participation. One of the things we're most excited about is the partnership that they have with Richmond Public Schools, and particularly the work they're doing to do their ESL Summer Academy. In talking with Amanda and learning more from IRC about their vision for implementing this grant, they're looking at leveraging this to be an incentive for participation among newcomer students who really do need summer school programming, but who otherwise may not be interested in pursuing it without both the enrichments and extra activities that are provided through this grant, but also the navigation services that IRC provides. As anecdote, we were just speaking a little while ago about some of the youth in her program who are participating in Mayor's Youth Academy through Youth Engagement Services this summer, and how daunting just the registration process is for so many of them who are unfamiliar with our systems. And so IRC doesn't just match kids to programs, they're literally sitting with kids and sifting through their documentation and paperwork and ensuring they have the resources they need to participate fully. And so finally, that actually leads into the final point, which is that this investment allows us to really maximize the impact of other investments that we have. IRC has active partnerships with the James River Park System, the Positive Youth Development Funds, grantees, and as I mentioned, the Youth Engagement Services, which allows us to really target a population that has historically been underrepresented in all of the participant groups for these programs. And we've identified through data analysis that we do not see representative participation among newcomer youth comparative to how many are in the city in these different programs. So with IRC's help, we're going to be able to offer those supportive services that'll get more kids to participate. I'll pause there and answer questions.
No, I don't have any questions, but I was gonna say, I think this is great. IRC is amazing. I know Amanda and the work that she's done from when she was actually a teacher in RPS, working with these same young people and as well as refugees. So I think it's gonna be amazing and look forward to seeing how it grows and scales, and supports, another community in our city that needs those resources. So,
Thank you.
Thank you.
Yeah, I couldn't. I wish it was $25 million. I couldn't think of a better time to support this than now. So with that, motion to recommend to full council.
Second.
The committee is voting on the motion to forward item 1, ordinance 2025-089 to council with the recommendation to approve. Ms. Jones?
Aye.
Vice Chair Breton?
Aye.
Chair Lynch?
Aye.
That motion has been approved.
Alrighty, Madam Clerk, can we move on to the acceptance of the minutes?
The minutes to be approved are for March 13th, 2025 for the Education and Human Services Standing Committee meeting held at 2 p.m. If there are no amendments or corrections, then the meeting minutes will stand approved as presented. Those minutes have been approved. Thank you.
Well, I believe that means it is time to adjourn this meeting. No, it's not. It's not. It's not. No, what's happening next? Did I miss something?
Sorry, I do have some business to cover.
Oh, great. Let's hear it.
So committee members, earlier in the month, as you know, during our last in-person meeting, we had Superintendent Cameras here with us. We were discussing or beginning to discuss the budget, and we thought it prudent to collect questions from the full body of council, send those to the superintendent's office, and then share publicly what those questions were. So before you printed out is the holistic list of the questions that were sent in from the full body. We are going to post these publicly so that you all can see them, since we didn't get to have a more robust discussion when the superintendent is here. The superintendent would be here with us today, but he is appreciating teachers. It's Teacher Appreciation Week. Woo! And so he is in schools right now as we speak, loving on some teachers. So he's doing a much more important duty and role than being here with us today. But he would otherwise be here with us, and we were going to discuss, options for moving forward collaboratively. So one of those options, and we've discussed it, I think amongst, during the budget season and amongst ourselves, was to host a joint meeting between our school board colleagues, the superintendent, and city council and the administration. I think that there was a lot of interest to do that, but we all were like, hey, let's let the dust settle from budget season. So I've spoken with the superintendent about that, and some of our school board colleagues. I believe they are enthused to do that, and so I wanted to put that before you all today, and then the full body for discussion.
I'm open to it. You just know, let's have a plan. Otherwise, I'm good. I think it's cool.
I agree. I think we're in a new season and spirit of collaboration across the school board, the administration, city council. I think everyone is looking forward to a constructive relationship. And so I think it's a great time to be having these conversations.
Yeah, you these are yours to keep. Yep. And anyone else that wants to have a hard copy. Okay, so we will take that to our next OD meeting for discussion and the recommendation to have a plan. I don't want to put an agenda down, but we'll talk. We will put some recommendations together from the body and move forward from there. Okay. And then the only other kind of housekeeping EHS update, and I know, Will, you're wanting to jump in here with the staff update too, I'm sure. You want to, and then I'll go.
Thank you, Madam Chair.
Go ahead.
Yes, so I think the only additional parts I'd mention at this stage is just to let folks know about plans for the meeting next month. For this committee, we'll be meeting in June. I don't have the date right in front of me, but the June meeting for this committee will cover regional coordination with related to case management services around homelessness, as we've talked about several times, and additionally gun violence prevention efforts with the Richmond and Henrico Health District and RPD. So we look forward to those presentations and coordination with our area partners. Last piece I'll say, I did note you asked for follow-up on the budget related to direct mail. We'll make sure we get an answer back to the committee on that, and we'll support efforts with the school board coordination as well. Thank you.
Thank you so much. Well, that's a great segue to what I had to share, which is during our community conversation around homelessness and the after action review for the inclement weather shelter, we had several action items that came out of that meeting, and I believe that we had 2 with a June due date. So off the top of my head, I don't want to get those wrong, but if we can make sure that we are tracking to have those report outs in our next meeting, that would be super great. And then, of course, I had a emergency situation pop up at work, and so it was a little tardy. But I wanted to take the time to acknowledge my friend and colleague. We are so glad you're here, Dr. Popovich, and I'm so loved what you've done at the Department of Health. Really encouraged by your energy and passion, and just overall smarts and intentionality. So I look forward to working with you and getting cozy with you. This is, no secret. HHS is, heart and soul for me personally and professionally, and to all of our committee members. So we are just, again, very, very appreciative of you being here and the partnership. So welcome to the fray.
All right. Well, I think I may now be able to adjourn this meeting. Thanks, everybody.